Diane Brewer reports.
Pressure Group Patients First Bermuda includes more than 75 physicians under the Bermuda Medical Doctors Association, as well as dentists, physiotherapists, nurses, pharmacists, and employers. They are petitioning what they refer to as rushed changes that would lead to a government-enforced monopoly on health. We spoke to Dr. Janie Brown, treasurer of the Bermuda Dental Association, about their concerns on these proposed changes.
We were concerned that this would have an impact on the health care of all of our citizens here in Bermuda. And we have expressed our concern to the Minister of Health in regards to this, but it seems that it's been falling on deaf ears. And so we felt we had no other alternative but to create a campaign so that everybody is aware of what is at stake with their health care.
Some naysayers feel that this might only be about doctors protecting their income. We asked Dr. Brown for her input.
This isn't about our income. Really, it isn't, because the reality is that we're patients too. And so this has to do with our health care, our family's health care, and our own. We may not be able to afford to have any supplemental insurance, which means we'll have to rely on this one unified plan. If that doesn't cover us for everything, what do? What rights do we have to seek treatment overseas if we only have this one plan? I think that the government is expecting most people to purchase a second additional plan, which for many will not be achievable.
As seen in other countries with similar healthcare systems, extended wait times might be an issue.
It will impact wait times. It will impact any retirees who already have a health insurance plan with their former employer. That insurance plan may become null and void because they're going to have to pay into this new plan. So where they are fully insured, they may find themselves underinsured and unable to pay for a secondary plan. But yes, there will be wait times for just about every single thing that you can imagine. And you know, in the private sector, you know, if we're unable to make enough, to generate enough income, then we can't invest back into our practices. That means that we can't buy the new equipment that's out there that would provide the better treatment for our patients. So you'll be getting a substandard quality of care, which is not what Bermuda is used to.
We asked Dr. Brown, are the local insurance companies also involved?
We have spoken to the insurance companies, and they have all expressed dismay with the government for moving towards a unified scheme like this. And they have offered solutions on how we can manage the people who are uninsured at this point. There are only slightly over 2,000 people who are uninsured that we know of. Now, government's numbers keep fluctuating, so I think that it's important that we get the numbers right first.
There is misinformation in the general public. We asked Dr. Brown to tell us where the public can find more information on this topic and how they can get involved.
Speaking to my patients every day, all day, none of them are really aware of what's going on. They just seem to be asleep about it, or they have been unaware of it. And I suspect that our government hasn't done a good enough job putting that information out there. A lot of the information has been confusing. I've been on their Q&A site, and even their answers are very incredibly vague and confusing for the general public. So I think that this government has a lot to do. Rushing to push something through as massive as this, pushing that through by 2020 is irresponsible. Deadline is December 8th, and you know what? There is something that people can do. They can sign the petition that's online. It's on Facebook, on Patients First. They can go to the website. They can write their senators. They can write their MPs. They can voice their concerns. We're hoping that we can organize a march so that our politicians really do listen to us and listen to our concerns.
That was Diane Brewer reporting, and we'll have more for you after this short break, including all the latest weather news. Stay with us.